Well, in April 2008, I was knocked from a bike by a speeding driver, so I had a number of injuries. I hit the road with my chin, hence the loss of teeth and broken jaw, and then I hit the road on the side, on the right-hand side, so I have more bruises down that side. So I was in hospital for a while, and my jaw was wired, and then I was sent home. About 6 weeks later, I started to feel very unwell. I got flu-like symptoms. I do work for the NHS, and so I self-medicated, got out the paracetamol and took myself off to bed and rested. But by Monday morning I was feeling much worse, so my husband took me down to the doctor. He rang the orthopaedic department at my local hospital and asked if they'd see me because he felt that I had cellulitis. Probably about 11 by the time we got to A&E, and we went through the system. It was about 3 o'clock by the time it was decided that maybe this wasn't a leg problem because I had recent surgery on my jaw. It was something to do with the max fax surgery that I'd had, and max fax wasn't done at the particular hospital, so they got in contact with the second hospital and said, please will you see this lady, she's got an infection and we want to rule it out that it's a jaw. So my husband drove me to the other hospital, went in via A&E, was triaged about an hour later. About 7 or 8 o'clock I went up to the dental ward. I was very unwell by this point. I was suffering from what I believe are called rigors. I was shaking a lot, obviously vomiting, and sometimes was very hot and needing to take everything off, and other times was very cold and needed covering up with blankets, and my husband sort of holding me down in this chair. And the orthopaedic surgeon came up about 10 o'clock and agreed the infection was probably in my leg. They couldn't actually find anything in my jaw. A number of the people that I'd seen had said you need IV antibiotics, and once you get those you will start to feel a lot better. But unfortunately nobody actually gave me any antibiotics. They were very kind to me and patted my hand and gave me some paracetamol, but I wasn't given any IV antibiotics. So about midnight we got word that there was a bed, and again it was said, you know, when you get some IV antibiotics you'll start to feel a lot better. At 2 o'clock I was put on a ward. I was given a buzzer to hold, so I pressed the buzzer. A nurse came along and I said, I'm sure I should be having some IV antibiotics. So she went to sister to check and came back and said, you're quite right, but I'm really sorry nobody's written you up for any. The next thing I remember is this argument going on outside in the corridor around somebody needing to prescribe antibiotics. I guess eventually it was because the drips were put and all sorts of things happened. And then I woke up the next morning seemingly surrounded by doctors. The consultant who was looking after my face was there. There was an orthopaedic surgeon there. There was quite a bit of concern. But I was on IV antibiotics by then. The delay wasn't discussed really, and I think probably because I was, you know, sleeping and dozing off and drifting off, I probably hadn't realised just how time was getting on. Well, I was feeling exhausted, very fragile. Everyone was very kind to me, but I just felt that nobody actually did anything, and a number of people, medical people, said to me, you will start to feel a lot better once you start on IV antibiotics. It was actually 18 hours from when I'd seen my GP in the morning before I actually got any antibiotics, and I'm sure that didn't help my condition. The second hospital I was seen by the team the following morning, and also sister came along to see me and introduced herself and kind of apologised for what had happened the night before, and said, you know, she was really sorry, but she said just to let you know that I have filled in an IR1, an incident report. I thought, oh well, that's a good thing. The orthopaedic surgeon came back and said, would I like to go back to the first hospital, which was much nearer to home. So about 10 o'clock, I went by ambulance then, and I was taken onto a ward there, and I was on there for a number of days on IV antibiotics, and they were able to remove about 500 mils of pus from my left leg on the first day, and then on the second day it had all filled up again, so they did the same thing. And then I stayed on the ward, this wound was dressed obviously, and given the antibiotics and things for 5 or 6 days, and then I was discharged on IV antibiotics. And I was home for about 3 or 4 days, and then I got this high temperature again and this feeling of sudden hotness and shakiness. Obviously I knew what the problem was, so I asked my husband about 4 o'clock in the afternoon if he would take me back to the hospital that I'd been an inpatient at. We borrowed a wheelchair and he took me up to the ward that I'd been discharged from, where obviously we saw the team that we'd been with the week before. But a very sympathetic sister, an apologetic sister, said, "I'm really sorry, but we can't just take you on the ward. You need to be admitted via A&E." I was booked into A&E, and then I was triaged, and eventually I was seen by somebody from orthopaedics. People definitely thought I should be on a ward having some IV antibiotics. Having said that, we'd had another 6-hour delay, so things had probably taken hold again. I was put on a ward, and I was seen by the orthopaedic consultant, who said I definitely had severe cellulitis, sepsis, and that I would need an operation to remove some necrotic muscle. So that was organised for the day after. And I do have some numbness down the lower left calf that probably, after all this time, I've been told will probably be permanent. I suppose I expected, within 3 months of the actual injury occurring, that I would have been back at work, back on my bike and fit and well. And we're now almost 3 years down the road, and it's not over yet. I felt let down and ashamed. I was ashamed that I guess the communication systems weren't in place, because that's kind of almost what it was. It was as if everybody knew what was needed doing, and everyone was kind to me, but actually nobody did it. And it made me think afterwards, on reflection, had I been too polite and compliant? I'm not the sort of person to sort of stand up and scream or burst into tears or throw my toys out of the pram, but and surely I don't need to be that sort of person to get treatment. I mean, it also occurred to me when I was ringing for the sister at 2 o'clock in the morning, thinking about it later, had I been a little old lady who hadn't got some NHS experience and able to articulate, I might have just thought, well, they put me in bed now, I'm fine, and maybe rolled over and gone to sleep, maybe not woken up, who knows. In my view, all the complications were linked to the delays. Following on from recovering from this surgery, I was due to have some more surgery on my jaw, and that had to be delayed because I wasn't well enough to have that, so that was delayed for about 6 months. And when I did go back to the max fax surgeon to have what I thought were my implants fitted, my bone had deteriorated and my soft tissue, so I needed to have bone grafts and soft tissue grafts before I could have the implants, and I also needed to have some orthodontic work. So the surgeon said to me, everything's in hand, Julie, don't worry, we've put together a 2-year plan. And I sort of nodded and smiled, and then drove away from my appointment thinking, 2 years, we're already nearly a year into it, I'd expected to be better in a few months really. Within a few weeks of that, I actually had a sort of psychological breakdown. It just seemed to be, one knock too many. I'd been knocked back so many times, and I kept coming up, pulling my socks up, getting on with it. I'm not dead, I'm okay. And then it was just like, right, okay, well, another 2 years to go. I'd returned to work. I'd been back at work about 6 months. I just became unable to make a decision, very alert to thinking things were going to happen, having flashbacks. Apparently I was diagnosed with post-traumatic stress, and no one was surprised apart from me really, but I was sort of devastated at that point. Massive cost to the NHS. I mean, I was 16 days in hospital extra to what I needed to be. 16 bed days, I know that's a lot. You had lots of treatment, I follow up with GP, district nurses, afterwards months of dressings, months of physio. It was, in my view, it was unnecessary. If the antibiotics could have been given much earlier in the system on both occasions, I think the outcome would have been much better for me and for the service. It seemed as if everybody thought someone else should be doing it. Everybody knew what should be being done, but everybody assumed that someone else would do that bit. I have been asked, why I didn't make a complaint, and I think because I was so weakened after both episodes in hospital, I just didn't have the energy to do it. I didn't want to go through all the trauma of it. I was worried that one person might get the blame for this, and in my view it definitely wasn't about one person, because the treatment I had was was by individuals was good and kind, and I would say that if they were evaluated they would all come out fine, but I kept falling through gaps and I didn't really know or have the strength to make a complaint about the gaps and to be able to articulate that well at the time. I'm hoping by telling my story that people will kind of listen and see behind what happened, and the fact that it happened twice, so it wasn't a one-off. Within 4 or 5 days the same thing was happening again. This might be an opportunity for learning. So although this isn't a complaint, this is my way of saying please listen to this story and think about what's happening at your hospital. Could it happen here? Is it happening here? And if so, what can we do about it?